Hello, welcome to the Global Action Plan training course on talking to patients about air pollution for primary care practitioners. This is our agenda for today. We're going to look at an overview and the importance of talking to patients about air pollution. And we're going to hear a clip from Professor Sir Stephen Holgate on the health impacts. We're going to look at the patient pathway and consider ways that you can engage with patients at different stages of the consultation and the conversations that you can have. And I'm going to wind up with talking about how you can become a clean air champion. What are the learning objectives for today? We're going to look to see how you can gain an increased understanding of air pollution and what patients can do both to protect their health, reduce emissions and avoid unnecessary air pollution. We're going to look to see how you as a health professional can engage with patients at different stages of the patient pathway and think about how you can become a clean air champion.
Thanks, Cam. Yeah, that was great to hear. So I'm going to now be talking about some of the background as to what's been going on in recent years in terms of air pollution in the UK, and then talking about the overarching importance of air pollution and why it impacts people's health so significantly. It really starts with the tragic case of a young girl who lived in London called Ella Deborah, and she had asthma and unfortunately died from her asthma after having a number of significant life-threatening asthma attacks requiring admission to hospital. I think it was approximately 27 in just a couple of years. And then in the inquest to her death, the coroner was able to map air pollution levels over time to show that the spikes in air pollution had actually matched up with a number of her asthma attacks. And so it led the coroner to have confidence in saying that air pollution was a contributing factor in her death. And this is the first time anywhere that air pollution has been included on a death certificate in that manner. And off the back of this really significant public case, the coroner called on institutions such as the Royal Colleges for different areas of medicine to really step up and to actually understand that air pollution is a significant problem and that they, as institutions, need to make their make the different doctors and healthcare professionals aware of the impacts of air pollution so that they can speak to their patients about it. And in other areas as well, it's been called to be, this really important future step. So including, as an example, the asthma models of care, it also now calls on primary care to act on air pollution. So the Royal Colleges dutifully gathered in order to understand and respond to this, and they largely agreed that, of course, they are a good member and section of society when it comes to giving this air pollution information to patients. They agreed that they are trusted messengers in society, so therefore very well placed to deliver it. They certainly didn't agree, as in they wanted to state clearly that patients mustn't be the ones made to feel responsible for all the changes required in air pollution. Really, it is going to take a very wide systemic improvement at government and local government level to actually make a lot of these changes. But it is fair to say that there are some changes to behaviours that people can do as individuals to reduce their contributions to air pollution, as well as to reduce their exposure to it. The Royal Colleges also didn't feel that every individual practitioner needed to be a true expert in air pollution in order to actually have a successful campaign. And what is one of the really positive aspects is that air pollution messaging, in some senses, is quite simple, really, because air pollution is bad, and there are some things that we can do to tackle it. So you don't need to be a true expert in terms of how it impacts the body necessarily, like in its fullest sense, in order to be able to pass on messaging that air pollution is bad to the population. And then lastly, the Royal Colleges definitely felt that air pollution messaging would need to be delivered to different patient groups in different ways. So the young child with asthma would get a very different message than the elderly patient with COPD, for examples. So we're now going to listen to an excerpt from a lecture given by Sir Stephen Aldgate, who is a true expert in the field of air pollution. And yeah, it's going to last about 10 minutes, during which time he's going to talk about the pathophysiology, essentially, the underlying problems that air pollution brings into the body, as well as some epidemiology, looking at how it affects the wider populations. Okay, so I've started the selection at this point, which is technically the slide before where I'm going to actually play it from. But what's very useful about this slide is that it shows a number of sources of air pollution, as well as how it interacts with the environment. So there are, of course, a large number of sources of air pollution, including transport being one of the major ones in the UK. But there are also lots of manufacturing and industry sources, including energy generation from burning gas or historically coal in the UK, but obviously still a common problem around the world. And then there are natural sources, and there are many sources from things such as farming as well. And that's before we consider things in the home, such as the heating production and cooking and furniture, and like essentially there are such a large number of sources of air pollution. But it's really important to consider that all of these things, which can include carbon monoxide, carbon dioxide, sulfates, and nitrogen dioxide, as well as particulate matter, the little tiny particles that are talked more about in the video. These can unfortunately mix in the atmosphere and create secondary pollutants, which unfortunately are also harmful to human health. Anyway, I'll press the slide on from here.
So most of the recent work has focused on particles, but I wouldn't like anybody to believe that these are the only pollutants. And we must always remember that air pollutants are never breathed in as single entities. They're always breathed in as mixtures. And in the case of outdoor air, it's particles plus gaseous pollutants, which I've already referred to. It's the small particles, of course. These are sometimes labeled PM10 if they're less than 10 micrometers in diameter, or PM2.5 if they're equal or less than 2.5 micrometers. And there are even smaller particles called ultrafine, which are less than 0.1 micrometers in diameter. And those are the nanoparticles, for which we know actually relatively little about. But you can see, compared to grains of sand or to the diameter of a human hair, how small these particles are. And of course, they are the respirable particles which enter the nose and then through into the lower airways and the air sacs, where they cause the greatest problem. So this is a slide meant to summarize that inhalational route. We breathe the particles in through the nose and through our mouths into the lung, and they impact here on the airway epithelium, and here they pass through the airway lining fluid or the lining fluid on the surface of the alveoli, where they can pass through between epithelial cells into the submucosa and subsequently into the circulation. The larger particles, of course, are trapped on the surface here and can be expectorated, usually swallowed up by macrophages in the lung, and are expectorated in sputum over time. But it's these very small particles, which are shown here on the left-hand side. These are particles emitted from a diesel vehicle, and you can see the very small particles here measuring less than 2.5 micrometers in diameter. They do form aggregates, which will of course get trapped in the nose and in the lung, but it's the free particles here that are causing the real problem. And as you will see in a few moments, it's not just the solid particle that causes the problem, but the chemicals that they carry with them on their surface and in their matrix. Thus, on penetrating the epithelium and gaining access to the circulation, these particles then circulate and can disrupt cardiovascular homeostatic mechanisms, particularly endothelial dysfunction in the case of formation of atheromatous plaques in the heart and in the brain and in the peripheral blood vessels, accelerating platelet aggregation and causing vasoconstriction. And all of this is largely thought to be driven by what's called systemic inflammation, which I'll come to a little later, which is probably in large part triggered by the oxidative stress that these small particles generate when they come into contact with various structural or inflammatory and immune cells. So if we go on now to looking at some of the health effects, there have been many reports over the last 20-odd years in this country and elsewhere on the health effects of air pollution since the Clean Air Acts of 1956 in this country. But in 2016, I had the opportunity of bringing a group of people together under the auspices of the RCP and the RCPCH to actually look at the evidence base that had accumulated over the last 2 decades. And we were able to come up with some really quite remarkable statistics. The top one probably is the one most widely quoted, which is the 36 to 40,000 deaths brought forward each year in the United Kingdom by outdoor air pollution. But we believe this may be an underestimate, as I'll talk about in a minute. The number of children exposed to illegal levels of air pollution, living close to roads and roundabouts in our urban environments, the cost of air pollution to the health service annually estimated at £20 billion each year, and of course the wide variety now of diseases thought to be accelerated by this oxidant stress injury mechanism of pollutants gaining access to systemic circulation. And the mechanisms probably within the organs, whether the brain or the lung or the heart, is an accelerated aging process within that particular organ, which means that cells turn over and die more quickly than they otherwise would do in a healthy air environment. So now we're looking at some of the epidemiology, and of course this is the thing that's really informed a lot of the air quality guidelines and limits that different countries have adopted over the years. Population studies. This is a very large study in the United States of 60 million Medicare beneficiaries, which of course are a subset of the population, but it's a massive population, as you can see. And if we look at deaths on the left-hand side, and these are the so-called hazard ratios in relation to exposure to PM 2.5, and these are the increments over unity, which is which means that there is no hazard ratio. This is a log scale, so this is 0 on a non-log scale. It shows that for small particles, all the way down to 0 exposure, we're getting health effects and increased deaths from these particular particles. And whereas in the past, with smaller studies, it used to be thought that there were thresholds at different levels, like 25 micrograms per meter cubed, which is the threshold that's currently used by the European Commission, and 10 micrograms per meter cubed, which is the threshold used by the World Health Organization. You'll see even below those levels, there are increased deaths. And these dotted lines show the very small standard deviations around these estimates, which indicate that one can be almost 100% sure that these data are correct. And the same is true of the other pollutants. This is ozone. Again, you'll see passing through 0 here on this log scale. And the same is true of PM10 and nitrogen dioxide. And the important thing in big studies like this is that they've been able to identify health effects at concentrations below these national standards I've already referred to, namely the EC standards and the WHO standards, but also racial minorities and people with low income are the ones most affected. And this doesn't just apply to the United States here in this particular study, but all across the world. And there have been many studies now in Europe and Southeast Asia confirming that it's the socially deprived, economically deprived populations that are most susceptible to the adverse health effects of air pollution exposure. In terms of the various diseases that are affected, I mean, a few years ago, we just thought it was asthma and coronary heart disease. But now we realize a whole range of different diseases are affected by these levels of air pollution. And these studies have come out of epidemiological and mechanistic studies over the last 2 decades. And there's hardly an organ that's not affected by air pollution in one form or another. And you can see those that have been identified in the global burden of disease categories are the ones in a bold print here. So this is a serious systemic insult on the human body, accelerating the development of non-communicable diseases in human beings. Now, I've talked a little bit about the EU limits and the WHO guidelines. The WHO guidelines were generated in 2005 initially, based really on pure health-related considerations, whereas the EU limits incorporated trade-offs when people from industry and from the oil producers and car producers started lobbying the European Commission. And you'll see the difference here between those that are exposed to excess illegal limits if we use the EU measures versus the WHO guidelines. And you'll see here that there's hardly a single individual in the world not exposed to illegal levels of PM2.5 if we were to adopt the World Health Organization health-related guidelines.
Okay, so I'm going to pause the video there, just because that's the end of the selection that we've taken out for this training video. But I'm just going to pause here and add that the WHO targets that are being talked about, as well as the European Health Agency's targets that are mentioned here by Sir Stephen, are actually, they've been updated in 2021 to even more stringent targets. So you'll see that the number of these red figures here on the displays would be even greater. And it would mean that if we adopted actual modern WHO targets, then we would need to have much more significant changes as well. So it really does highlight that really most of our populations can unfortunately be said to be exposed to dangerous levels of air pollution. There really is no safe level of air pollution. Anyway, moving on now. So you'll recognize this slide from the presentation, or the picture at least. And I just wanted to bring this up to mention through a couple of things that Sir Stephen didn't mention in detail, but then also sort of consider and take it forward from there. So certainly, the cardiovascular disease and the respiratory disease was mentioned, but it's worth saying that the actual decreased lung function and the decreased lung growth is really significant for children. In terms of high levels of air pollution will mean that they have decreased lung function as older people throughout their adult life, and it makes them more likely to develop conditions later in life. This is unfortunately true as well for their neurological development, and large studies have shown that learning is much poorer in areas where there is significant levels of air pollution in particularly large cities. The other main area that wasn't talked about as much in the video there was in terms of fertility and pregnancy. So actual fertility rates are certainly lower, unfortunately, and specifically the actual growth of the fetus, the growth of the child inside the womb is definitely lower. So it leads to a decreased birth weight, and unfortunately can mean miscarriage or other premature births are also higher due to air pollution, as in they're more likely to occur. So now that we have this different lists of pathologies, these different illnesses that can be caused or brought along by air pollution, we want to bring that into our patient groups, the sorts of people that we're going to be talking to. And then on this slide, you'll see how we've sort of boiled down that list of different pathologies and made it into our list of patients. There are some of the more obvious ones, such as the respiratory conditions, both adult and child, but then also just the wider group of all children, because if high levels of air pollution impact on a child's development, then actually all children are reasonable, relevant people to talk to, as well as their parents, of course, or carers. There are the pregnancy and fertility, and then the cardiovascular diseases, the metabolic diseases such as diabetes, and then elderly patients with conditions such as dementia. There's the larger group of mental health, because while we wouldn't say that air pollution is a single causative factor in terms of poorer mental health, it can definitely be a contributing factor, which means that these are reasonable patients to talk to. And I'll go more into how we do that in a minute. And now that we've got the different groups that it seems very relevant to talk to in terms of air pollution, we can just consider how to effectively bring that messaging to them. In terms of these effective communications, it's definitely fair to say that if we have this message reinforced in several ways, then it's more likely to sit with the patients, it's more likely that they'll bring it on board, and it's more likely that they'll retain this information and potentially have behavior changes as a result. So even just one example of a patient journey, you could have a patient who they phone up for an appointment, and while they're waiting to connect to the reception, there might be some clean air messaging that they hear. Or while they're sitting in the patient waiting area, then they can see posters or something on the electronic screens comes up talking about air pollution as well. During the actual consultation with the health professional, then the health professional manages to talk to them about air pollution potentially as well, if it's relevant to their condition. And then, especially if it's relevant for them, then they might be given a leaflet or an electronic version of a leaflet to go home with as well. And these are all resources that we've helped prepare at GAP and are available on our website. So diving a little bit deeper in now, in terms of, we've separated it here into opportunities before the consultation, during it, and then after it. And then I'll not just read this list to you in a sense, but there are a really wide number of opportunities that can happen even before the patient gets to the consultation. And that there is significant difference in this age of COVID, post-COVID. It's definitely worth saying that there's significant differences in-person versus electronic online consultations. So most practices will have a website and social media pages, and it's definitely an area where this messaging can be brought forward. A lot of practices will send text messages to their patients, maybe about appointments, and sometimes they'll get appointment reminders through the posts. Some patients, when they are coming in for prescription requests, that could be another opportunity as well. And I've already mentioned about waiting room screens and notice boards. It's also worth saying that some patients, as they come and register newly to the area or to a new practice, then it would definitely be a really useful time to give that health information to the patient about what air quality is like in their area and what they can do to maybe avoid the worst air pollution in the area. So those are some of the opportunities before the consultation. And now considering during the consultation. Now this is, for most of us, the most important part of why we do what we do is in order to have these, consultations with the patients, to discover what's going on with them and to help. And this can really be a great opportunity to pass on some important messaging to them about air pollution and how they can avoid it. So during the history, this would often involve asking the patient lots of questions, trying to get information about their everyday life and how the condition might be arising. And it could be possible to integrate some of that messaging into their consultation. So the classic case of, I'm breathless, doctor, and I don't really know why. So certainly during that, you'll be talking to them about how much they walk and where they walk. And that can be an opportunity to say to them, well, just while we're looking into this, and general good advice anyway, to be honest, is that maybe while you're walking to the shops, if you're able to consider going down side streets or going through the park instead of going down the main street where all the cars go. So yeah, just really integrating that into the conversation. When we're considering the management plan or giving perhaps lifestyle advice on the rare occasion when we have some time at the end of the consultation, then you might be able to work through a leaflet together, which will actually demonstrate as part of this, as part of the presentation here, we'll show you some leaflets that have been developed for the projects for teaching GPs and other healthcare professionals. And on there, there's a number of specific points of advice about what the patients can do to reduce their contributions as well as reduce their exposure to the air pollution. And one example for you now would be that if you're giving the patient advice to maybe try some more exercise for improving their health overall, then you certainly don't want to be increasing their risk to nasty air pollution at that same time. So it's definitely worth saying to them, if they are trying to go, for outdoor exercise, then trying to do so in a green space or down back streets, if they do have to go down the streets, is definitely, a way for them to avoid the worst air pollution. And then lastly, as you finish the consultation, then you can be signposting, and this might be by pointing them in the direction of good websites, such as the Clean Air Hub, which is mentioned in our leaflets as well. And then you can also be handing them leaflets and other materials such as that as well. And then just a little bit on post-consultation opportunities. It's worth noting that a lot of practices will have link workers or be using social prescribing. And then for the walking groups, which might be associated with your practice, you could actually speak to the leaders of those and ask that they make sure to go through green spaces or side streets. And then it might be possible that you can give some education to these leaders of the walking groups, or even leaflets for them to hand out. If you have pharmacies attached to your practice or sort of closely aligned with it, then it might be possible to put posters up there, or if they've got electronic screens, to do a similar thing. And then lastly, as I mentioned, after the consultation, then the patients might be given, say, an electronic PDF version of leaflets or posters, and that could similarly happen in emails and texts. Just a quick note on what I would say is sort of specialist consultations and how they are particular opportunities. Obviously, most practices, often led by practice nurses, will have an annual asthma review, and that can essentially go through a personalised asthma plan with each patient. And our checklist versions of our leaflets actually are quite useful in that they have that similar tick-off feeling to them, which gives the patient that sense of ownership and control in their condition. And there are many other opportunities as well during the different types of consultations as well. It's worth pointing out a couple. For example, the 48 post-discharge reviews, which often happen with our patients with COPD. During the many midwife and sort of pregnancy checks that happen, as well as the newborn infant checks that will often happen at 8 weeks. These are great opportunities to speak to our patients about air pollution. And then a couple of what I would call almost more opportunistic opportunities in terms of when to have these conversations. So you have patients who are coming in to get their annual flu vaccines, then you might not be speaking to them very much about other health conditions. And that can be an opportunity just while you're preparing to ask them if they've been considering air pollution in their area, and then think about some of the things that they might be able to do about it. and similarly for the usually nurse-led phlebotomy, for example. Okay, so as a sort of tone break, and to see what has often been described as a really inspiring video, one of the GPs in our national programme, Dr. Sinead Millwood, created this video before she even came to the national GP project, during which she wears an air quality monitor attached to her bag while she cycles her commute to work. And so I'll start just partway into the video and then finish it just before the end in the interest of time. But it is, I think you'll agree, a really excellent video, and unfortunately shows pretty high air pollution levels in areas even that you wouldn't necessarily expect. Okay.
This is Withington Road. I've come off the loop now. The measurement here is 95. So again, not good. And it's gone up again on the nitrogen dioxide, 95 again. So now I'm outside St Margaret's School. This is one of the local schools for my surgery. I've probably seen some of these children in clinic. The pollution level here right now is 101. So that is in the very high, dangerous region. Prolonged exposure to this, or even a short exposure to this, is not good for the children's lungs as they're developing. And the nitrogen dioxide level's gone up to 102, which is a bit scary. As you can see, it's just missed the drop-off time, so probably we're at our peak time for emissions in this area. New research by Queen Mary University of London has shown that 60% of the pollution that children take into their lungs every day is during the school run. So we need to make some better choices. So I'm at work now, ready to start the day. I can see that on my list of patients there are a couple of asthmas, a couple of people with medication queries for problems like stroke, one possible chest infection. And these are all things that have been contributed to by the air pollution in this area.
Fine, so yes, I'll just stop there in the interest of time. And it's actually worth saying as well in this video that right at the end, unfortunately, after these parts of video were recorded, there's text that comes up at the end in the video which says that Dr. Millwood and colleagues went back to this school actually during the rush hour, during the delivery time of when the school kids were arriving, and the air pollution levels were even higher and by a significant margin. So it really does show that the air pollution exposure that these children have is in a really significant spike during the times of day in which they're outdoors most, which is on their way to and from school. And so it's really, you know, vital that more work is done to reduce this. Okay. So I'm just going to run through some of the patient leaflets that have been designed for our projects for primary care. And thankfully, these are going to be sort of widely available from our website, and they are also not specific to primary care and can certainly be handed out in clinics or other avenues such as that as well. And in it, we've got this sort of specific messaging to patients, the specific asks that we can have of them in order to reduce their contributions to air pollution, as well as reducing their exposure, importantly. We have 4 types of leaflets, and I'll run through them just now. The first of which is an adult-focused general information leaflet. And these are all on 2 sides of A5 in terms of how they've been presented. So on the first side, it goes through a number of the health effects of air pollution. It talks about, you know, how it's extremely important and it impacts us from our first breath to our last. So throughout the whole of our lives, it reassures people that there are some things that we can do to help in terms of improving their health. And it signposts them to good websites that we have, including Clean Air Hub. which is a patient-focused website, which is part funded by DEFRA as well. And yeah, it's a really excellent resource. On the second side of our first couple of leaflets, it has a number of health choices and behavior changes that people can do in order to improve the air that they breathe. And that's also initially split into outdoor air pollution sources, and then secondly into indoor air pollution. And some of these, are, as you would expect, trying to drive as little as possible and trying to walk or exercise when people are doing their journeys to work or school. And using side streets, in particular, avoiding sort of busy hubs of traffic as much as possible. And then in terms of indoor air pollution, we ask people to use milder cleaning products and fragrance-free products as well, and avoiding plug-in fragrances, trying to avoid paints and varnishes and actually ventilating as much as possible when you are using them, but then using ones which are labeled low VOC, which stands for volatile organic compounds. And these are products and chemicals which are known to be harmful to human health. Asking people not to smoke in your home as well is a relatively obvious one. And then also, though, reducing home burning as much as possible. And this can be things such as candles and incense, but then also particularly things like open fires, log burners, coal fires, because these are, really unfortunately, they're harmful to the health of the people sitting in the room, but then also they just put lots of smoke and particulate matter out into the atmosphere, which affects the area that these people live in as well. And then when people are doing things such as cooking and cleaning, really ventilating as much as possible, that's a really vital and important step that we ask people to do. But also considering if you live in the city centre, then maybe not opening your windows during the rush hour as well. There's a balance to be had, and unfortunately there's no perfect answer in this regard. I'll just glance past the second leaflet that we have here, which is very similar, and it has a more of a child focus, more in terms of pediatric health. It talks about their development, the different health conditions that can be brought on, and then the actual guidance, the different behavior changes are very similar on the second page. The second type of leaflet that we have is that checklist that I was mentioning earlier in the video. And on the first page, it talks about a number of activities in a similar way that people can do to reduce their exposure. And then on the second side, it actually has a number of these actions with a tick box structure so that people can actually feel that empowerment, that they're taking some sense of control in their condition. And then it will be a sort of a personal commitment, essentially, in a way that hopefully will help inspire behavior change as well. So yes, we have two versions of that, one of which is focused on children and somewhat focused on asthma because it's such a common complaint in childhood. And then the other version is more generally applicable to the adult population and not sort of disease specific in the sense of asthma, but is otherwise very similar. Okay, so my final messages that I would like to give to yourselves and that I hope that you'll be able to pass on to your colleagues and patients is really threefold. Air pollution is so significant. It affects people all around the world and it seriously impacts your health, as in everyone's health, not just people who have these long-term chronic conditions and not just, young people and children either. It affects everyone. There are things that we can do to reduce it, very much on a sort of large scale systemic level, but also as individuals, there are things that we can do to reduce the amount of air pollution that we produce. And then lastly, and importantly, there are things that the individual and the family can do to reduce their exposure to air pollution. Okay, I'm just going to hand back to Camilla now, who's going to talk to us about becoming a clean air champion. Thanks very much.
So our top line messages for patients are that air pollution can seriously impact your health, but there are steps that you can take to reduce your exposure to air pollution, and there are steps that you can take to reduce emissions, air pollution emissions that you make. In terms of becoming a clean air champion, You can find resources at the Clean Air Knowledge Hub, which is available on the GAP Global Action Plan website. We want you to speak first with your patients. Think about what words and phrases work for you. How are you going to be able to communicate the information that you now have to different groups and different sorts of patients that come into your surgery? I really encourage you to be creative and make it personal, and get into a habit so that it becomes a routine as part of your consultations, that you can drop air pollution as part of your conversation with a patient. Do share the training with your practice colleagues, and do take the opportunity to share the message wider with education meetings at your local CCG groups. So let's just review the learning objectives from today. We've looked at the health impacts of air pollution, what patients can do to protect their health, how they can reduce exposure and their contribution to air pollution. And we looked at some of the ways that patients can change their behaviours to mitigate the risks of air pollution. We looked at the patient pathway and how you can engage with patients at different stages of that. And we also looked at some of the leaflets and materials that we have available, which are on our website. And we talked about becoming a clean air champion. So thank you for joining us today for this video. We really hope that you will now feel empowered and emboldened to take steps to engage with your patients. And I urge you just to take a few minutes to reflect on what you will first do to encourage you and support you in talking to patients about clean air and air pollution. Thank you for listening. Bye-bye.